When is home birth safer than hospital birth? Is there anyone here who thinks that home birth is ever safer than hospital birth? Well, here's your answer. Many people believe hospital birth is safer because it has more equipment. This isn't true. For low-risk women, I've done 600 births using more or less this equipment. Some scissors, a fetoscope, keep the baby warm, weigh it. In fact, one could argue that more equipment is less safe for low-risk birth. It's not the equipment. It's the formal education. Anybody attending birth must be formally educated to do so. We see this in the published rates in which they find people like me, who are properly educated, have less than 1 in 2,000 babies dying at home birth, whereas hospital rates for low-risk birth are generally 1 in 1,000 deaths per 1 per 1,000 deaths of the baby. And when lay midwives publish their outcomes, like the Farm published 4 per 1,000 deaths of babies, and Oregon 2 years ago published 5 per 1,000 deaths. The real question that interests me is what would be the outcome of births of low-risk women with the head down and a term without anybody educated attending the birth. And I would make an educated guess to say it's about the same as being attended by a lay midwife who's not adequately trained. And that's because the real difference is made by ability to do resuscitation. And people who don't have that, it's as like delivering without anybody attending the birth. Most people ask, how could home birth be safe when you don't have the equipment to do an emergency cesarean? So I spent 5 years looking for what are the reasons, what are the situations where you need an emergency cesarean that might happen at a home birth. I found 2. I know there aren't any more. I've been studying this for 5 years and I've read everything. Does anyone know what those 2 situations are? The main one is cord prolapse. Cord prolapse is when the head, after the sac breaks, the head pushes down against the cord, causing the baby not to get oxygen. So why would I do home births if there's a situation where the baby would have a better outcome if they were in hospital? And the reason is that I prevent all cord prolapse by not breaking the water and not doing vaginal exams. And not just me, but other practitioners who don't do vaginal exams or break the water found the same. They had no cord prolapse at home births. At a home birth, which would be better dealt with in hospital, is amniotic fluid embolism. So again, the question is, how can I justify doing home births when the woman has a chance of having a better outcome in hospital? My justification is that amniotic fluid embolism has never been documented to happen at a home birth during the birth when the midwife was there. It's only been documented once in Japan after the midwife left, and recently somebody reported to me personally that it happened before she got to a birth. In both situations, the mother died, the baby survived. They transferred to hospital. However, it still could kill the woman. And how often does that happen? In hospital, amniotic fluid embolism now happens 1 in 15,000 births, and probably such an increased rate is due to the many births that undergo augmentation or induction. But at home, 1 in a million. So, when I inform women of this risk, I also inform them that if they don't deliver at home, if they do have a home birth, a hospital birth, if they go to hospital, then 10% of low-risk women will undergo a cesarean that could have been avoided by staying home. And among those thousands of women, 1 in 5,000 will die of the cesarean. Therefore, the risk of going to hospital is greater than staying home, because at home you have 1/100th of the risk of dying. Hospital also includes other risks that do not happen at home births, such as fetal distress. 600 births, I've never had a case of fetal distress, whereas in hospital, fetal distress occurs 10% of births. I don't have an explanation for this. I can guess that perhaps hospitals cause the mothers to be more stressed, and this causes the babies to be more stressed. Another thing that will never happen at a home birth is a 3rd or 4th degree tear. This happens from vacuum births or other complications, other episiotomies. At home birth, it could only happen if the woman does not inform the person attending the birth that they have had a previous 3rd or 4th degree tear at a hospital birth. Placental abruption only happens in hospital from hospital interventions at low-risk birth. And uterine rupture only happens on women who have a scarred uterus, so if you do not do women who have scarred uteruses at home, you will never have a uterine rupture at home. Of course, hospital-acquired infections are prevented by staying home. So, in addition to hospitals making certain things happen that would never happen at home, home appears to prevent certain complications, or have better outcomes of certain complications, such as less fetal distress. Shoulder dystocia doesn't make a difference where you are. You have 5 minutes to get that baby out. So you could argue that it's safer at home, where the person attending the birth is already in the room and you don't have to waste time calling experts. In addition, home birth might have better outcomes because many births are done on all fours on the floor, and this prevents shoulder dystocia. Preventing hemorrhage on low-risk women, it doesn't matter again what the setting is, where you are, home or hospital. To be good at delivering the placenta, you have to deliver the placenta 4 or 5 minutes after the birth in squatting, and you can prevent all postpartum hemorrhage. If you want to prevent breathing problems of the baby after birth, deliver on all fours and pause after the head is out. Let the baby sit there until all the water or meconium drains out of its nose and lungs and out its mouth. And then once the baby is born, it'll be clear and not have breathing problems. Newborn GBS is a very complicated subject, which I could speak about for 2 hours. But in one sentence, the rates are certainly not worse at home, and it's not dealt with better at home, and it's possible that home birth might prevent some newborn GBS by keeping the baby warm and not doing vaginal exams. But in any case, low-risk women have a low rate of newborn GBS, which is about 1 in 5,000. It also might be prevented by delivering the woman into hot water. Newborn resuscitation is the main difference that makes the difference in statistical outcomes, like the home birth midwife at home versus hospital versus lay midwives at home. You have to be good at newborn resuscitation to save that extra 1 in 1,000 babies. You have to do it fast and well. This is a baby who is not breathing. You can see by her color, she's completely white. This is the only picture of a baby that needs resuscitation that I could find on the internet, and this is at a home birth. I disagree with what this midwife did, handing this baby who's white and not breathing to the mother. I would start by startling the baby, making it feel like it's falling quickly, and having it startle and take a breath, and getting the baby to breathe on its own within seconds after the birth is what you want. If this doesn't work, of course, you might have to breathe for the baby until it starts breathing on its own. I hope this has explained when home birth is safer than hospital birth, and you now know the answer to that question. The answer is home birth is safer when you have a trained attendant who's excellent, who doesn't break the water, who doesn't do vaginal exams, the head is down, and the woman is term and fairly healthy. It's not the equipment. It's the education. You need properly trained personnel who prevent cord prolapse and prevent amniotic fluid embolism by not intervening unnecessarily. This will result in slightly better outcomes on low-risk women for home birth than hospital birth. But if the midwife or doctor is not properly trained, then you will have worse outcomes. In summary, home birth has better outcomes with a well-trained midwife if the head is down, the mother's more than 37 weeks, and the mother is fairly healthy. Given these facts, that women still deliver in hospital even if they're low risk. You could say the answer probably don't want to think too hard about the risks of hospital versus home. People like to believe the stories they're told in the media, such as before hospital birth, women and children died in childbirth that are now saved by being in hospital. Or the women who say, I or my baby would have died if I'd had a home birth. I was saved by the hospital. Are these stories true? No, they're not. In 1200, Rabbi Maimonides published that less than 1 in 1,000 women die in childbirth. This is about the same rate as today from hospital birth. In 1800, Martha Ballard kept a diary. She did 812 births. No women died in childbirth, although 5 women died in the first month from infections. Margaret, too, did a statistical analysis and found home birth safer than hospital birth during the years 1930 to 1980. Agnes Gareb did 3,500 home births between 1989 and 2010. No women died, and only 1 baby died in the first week of all those births. Today, the 1 in 5,000 women die at birth in California. That's about the rate of maternal mortality. Women who go to hospital birth with low-risk babies and low-risk pregnancies, who have the option of a home birth with a well-trained midwife, are being optimistic in the face of reality. They're assuming and believing that they are not going to be the woman who dies of a cesarean. They won't be the woman who's permanently incontinent of feces from a 3rd or 4th degree tear. They won't be the woman who's paralyzed by an epidural. However, women who are being rational, who have the option of a qualified midwife who will not do vaginal checks or break the water, and the baby's head down, and after 37 weeks, will have 1 in 1,000 less perinatal deaths than at hospital birth if they stay home and have a planned, attended home birth. Thank you.